Oh no, you have a gunshot wound and you're bleeding out. You're losing consciousness and they wheel you out to the operating room. As you're about to pass out, you come face to face with the one operating on you, an AI robot. Have we really come that far? Remember when they did surgery on a grape? When an AI could be one of your surgeons providing an end to end experience from pre operative planning to post operative care? When an AI knows what to do with medical information? Could generative AI be your new healer? Does an AI become a machine that uses another machine to cure you? AI isn't something new. It's been evolving for more than 60 years. But it may have been possible that OpenAI's release of ChatGPT changed the game for AI. And generative AI has been evolving too. Photorealistic images, those Tom Cruise deepfake videos you keep seeing on the web, text that sounds way too human, and more. There's something to marvel at based on how far we've come. So, as a human medical professional, what can you do and where can you go to find out how AI is penetrating healthcare? Let's say your first stop is a lounge where a couple of doctors are holding a differential diagnosis. Maybe an AI could be developed to think like Gregory House of House MD and diagnose and treat patients a bit better. Working with human doctors, teamwork could help ensure that diseases are detected earlier, increasing some chances of getting cured. An algorithm could go through a whole lot of medical images and draw patterns that point to a certain disease. Your next stop is a private company that's manufacturing drugs. Because an AI can maybe now work towards designing new drugs and understanding whether a patient would get better or worse. Imagine an AI going through huge volumes of data and a large data set of chemical properties and structures to identify certain molecules that can become new drugs and fast track the drug development process. Currently, it's said that discovering drugs in a pharmaceutical sense can be cumbersome and time intensive, having to test possible candidates and find out how safe and effective a drug can be. Generative AI could maybe use deep learning, which is tech that tries to replicate how your mind works when you learn something. But a computer is trained to do that by working to solve problems and make decisions, just like your brain does. Maybe there are certain molecules that exist only on a computer created by an AI. Scientists can create these virtual compounds by combining some atoms and arranging them in a special way, with AI finding how they can interact with our bodies and whether they're viable. This could maybe even reduce costs, but maybe don't hold out too much hope on the cutting costs part of it. Efficiency also has its own markup, and an algorithm could also identify some proteins and genes that are associated with a certain disease, helping researchers in that manner. After that, you go to that place where medical prosthetics and implants are 3D printed. Could an AI optimize the design and material process for devices? Maybe it can go through a patient's file to customize the devices for maximum performance. And if some medical device could have some performance issues, AI could be used to understand how the device's lifespan can be extended and also ascertain if there could be any future defects. Then hurry up to the radiology and pathology department, or it goes through a patient's x-rays, MRIs, CT scans, and other medical images to find out what's wrong with the patient. A high resolution image can be the difference between life and death, literally, because there are even clearer aspects to an image that a regular medical image may not show that clearly. And it doesn't have to be 2D. Your once traditional medical imaging data could have a holographic representation, giving surgeons a comprehensive understanding of a patient's body. And just see how complex and convoluted the human body is. An AI could help professionals understand it more clearly with ease and accuracy, mitigating some surgical complications. Or maybe an overworked doctor or technician needs a second pair of fresh eyes to accurately interpret scans or other medical images. Nothing wrong with a second opinion, but something to think about when that opinion is of an AI. Similarly, if a surgeon wants to practice a complex procedure, sure, They can ask for a human to allow them to cut their body up for practice, but they might politely refuse. An existing alternative is using one of those medical dummies, but maybe there needs to be a tiny bit more nuance for them to really get into it. Now, with a virtual environment and super realistic surgical simulations, AI can help with practice. Could this mean that the metaverse has a lucrative opportunity in the medical space? Could healthcare save the metaverse? Or think of yourself as a surgeon. You now have a friend, mentor, or coach that's not real. It's an AI and it's giving you feedback, advice, and guidance with actionable insights on how to improve technique and reduce risk. Hurry up to that place again where medical prosthetics and implants are 3D printed. A likeness of your patient could be printed there to help practice for surgeries. Maybe the metaverse of putting on that headset makes you a little queasy, so you can go this route. Or in the middle of a surgery, your surgical assistant is less human and more machine, handing you the scalpel and going ahead with the suturing. Or maybe it's that classic AI reassurance. AI will do all the boring, mundane, monotonous, administrative stuff, leaving you to do important things. Patient profiling includes health records for the patient, medical notes and images, and if the patient has had the issue for long, it could be years and years of unstructured notes. And AI could structure it for you and make it more comprehensive, making it easier to figure out what's wrong. These are just a couple of examples, but of course, there are more use cases to explore. American tech enterprise Nvidia announced in late 2022 that it was accelerating the development of medical devices that are AI powered and that can help doctors detect and measure anomalies and upskill their surgical abilities. And AIIMS in Delhi announced in 2023 that it would help develop a robotic training facility. So let's see where it goes from here. So is that it? Is it all rainbows, puppies, and sunshine? AI steps in, doctors, nurses, technicians, and others get help, and everybody lives happily ever after. The regulatory issues may be a bit unwelcoming because a patient's safety and a device's efficacy are important. So AI solutions need to be tested for a long time to make sure they're ready. And AI has had problems in the past dealing with bias, misinformation, and incorrect results. So it could be a complementary relationship between AI and healthcare professionals to figure out what's wrong and what's right. But the AI mustn't slow down the healthcare professional. And if the AI is being the patient file and needs to use a lot of data, how can data privacy be ensured? And what if the data set is not large enough? There's something called doctor-patient confidentiality. How would an AI abide? And how much of an open arm embrace would medical professionals give to AI to help them with their jobs? It's hard to say. Being a healthcare professional isn't easy. Becoming an expert and constantly upskilling yourself takes years and even decades. As a surgeon, experience and precision come from being part of different surgeries, watching and learning. But there may be human limitations. Expertise takes a whole lot of time. AI could learn much quicker and are unencumbered by time or memory. So, the opportunities for generative AI in surgery are lucrative. Could it make surgery safer and more efficient? How about it, Doc? Do you concur?